Hello everyone, welcome back to my channel. Today we'll see regarding bladder cancer. So the definition of the bladder cancer is a relatively a rare form of cancer that starts in the lining of bladder. It refers to any of the malignant growth of urinary bladder. So what are the causes of bladder cancer? There are 7 causes or risk factors of bladder cancer. Firstly, smoking, chemical exposure, family history of cancer, inflammation in the bladder, increasing age, consumption of high fat foods, and previous cancer history. Smoking. So, any person who is a chain smoker or chronic smoker, he is at risk of developing bladder cancer. Next, chemical exposure. A person working in industries, chemical industry, or a factory is at risk of developing bladder cancer. Family history of cancer. Any person, patient's family members, have they had cancer, so there is a chance of developing cancer. Next, inflammation of the bladder. If the patient had any of the diseases in the renal system or chronic inflammation of the bladder, so there is a chance of getting bladder cancer. Next, increasing age. Usually bladder cancer is observed in the old age people rather than the youngsters. Next, consumption of high fat foods. So if the dietary pattern of a person consists of excessive fat food, so there may be a chance. Next, previous cancer history. If the patient himself had any history of cancer, so he is at risk of developing the bladder cancer. So next we'll see regarding the stages of bladder cancer. The first stage 0, stage 1, stage 2, stage 3 and stage 4. Stage 0 is precancerous lesions on the inner lining of the bladder. So it is very small and it is unable to identify as a cancerous tumor. Next, stage 1, cancerous tumors have spread into the connective tissues. As we know, there are various layers in the bladder, so the first, it will spread to the connective tissue layer. Next, stage 2, the tumors have spread into the muscular wall. So we know the bladder is a hollow muscular organ, so the stage 2, the tumors will be reached till the muscular wall. Next, stage 3, cancer has started to spread into the local or regional organs. Along with the bladder, it will approach to other organs as well. Next, stage 4, the cancer is spread to the major organs which is located or surrounds the bladder. Next one is clinical manifestation. So visible plainless hematuria is the most common symptom. So the patient will not feel any pain when he is voiding. So but there will be hematuria, blood in urine. Next, infection of urinary tract is common. So when there is infection of urinary tract or UTI, there is a symptom like frequency and urgency is common. Next, polyuria, pelvic or back pain as occur with metastasis. So as the disease condition will progress, there will be pelvic or back pain. So how to diagnose the condition as bladder cancer? So first we can go with the cystoscopy. It is the insertion of the cystoscope into the bladder through the urethra. Next, biopsies of the tumor and adjacent mucosa are definitive. Urine analysis, CT scan, ultrasonography, cytological examination of fresh urine and saline bladder washing. Bladder washing means bladder irrigation. Newer diagnostic tools such as bladder trix proteins and bladder tumor antigens are the two tests to identify the tumor cells. So how to manage the condition? So the treatment of the bladder cancer depends upon the grade of tumor, stage of tumor growth and multicentricity. So before starting the treatment, we should know the what is the stage of cancer or grade of tumor means what is the size of the tumor, and multicentricity means how many if the tumor is having many centers within a hemisphere. Next, age, physical, mental, emotional status are considered in determining the treatment. So while treating a patient, we should always consider the age or emotional status of the patient. Next, we can go with chemotherapy. Chemotherapy with a combination of methotrexate, 5-fluorouracil, vinblastine, doxorubicin, cisplatin. These are the chemotherapeutic drugs which can be used to treat the bladder cancer. Next, intravesical BCG. So it is a special chemotherapy technique to insertion of the BCG. Next, radiation therapy. Radiation of tumor preoperatively to reduce the microextension and neoplasm and viability of the tumor cells. So, before surgical management, we can go with the radiation therapy to reduce the size of the tumor cells and lifespan of the tumor cells. Next, radiation therapy in combination with surgery to control the inoperable tumors. So some of the tumors cannot be operated, so if we are going with radiation therapy, it will be very helpful. Next, Next one is radical cystectomy. Radical cystectomy means the entire bladder as well as the surrounding lymph nodes are removed, which may contain the cancer. So how the patient will pass the urine is there will be a stoma opening in the abdominal wall of the patient. Next, what will function as a bladder? So the stoma or a opening is done on the abdominal wall where the two ureters are made to join and reach the abdominal wall where the urine can be drained. So it may consist of a urine bag or any other management. Nursing diagnosis: impaired urinary elimination related to hematuria and transurethral surgery. So we should maintain the patency of the indwelling catheter, ensure adequate hydration, monitor intake and output, including the irrigation solution. Whatever irrigating solution we are inserting to the bladder is also be calculated. Next, monitor urine output for clearing hematuria. Next one, acute pain related to irritative voiding symptoms. So administer analgesics medication, administer anticholinergic medication and opium suppositories to relieve the bladder spasm. Remove the indwelling catheter after the procedure. So I hope it's clear regarding bladder cancer. Hope to see you in the next video. Bye bye.